ಸೊ ನಮ್ಮ ನೆಕ್ಟರ್ ಮದರ್ ಆ್ಯಂಡ್ ಚೈಲ್ಡ್ ಕೇರ್ ಹಾಸ್ಪಿಟಲ್ ಸೋಷಿಯಲ್ ಪ್ಲ್ಯಾಟ್ಫಾರ್ಮಲ್ಲಿ ಲೇಟ್ಲಿ ಬರೀ ನಾವು ಪ್ರೆಗ್ನೆನ್ಸಿ ಬಗ್ಗೆನೇ ಡಿಸ್ಕಸ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಬಟ್ ಈಗ ಐ ಥಿಂಕ್ ಇಟ್ಸ್ ಟೈಮ್ ಟು ಟಾಕ್ ಅಬೌಟ್ ಏನು ಸಪೋರ್ಟು ನ್ಯೂ ಮದರ್ಸ್ಗೆ ಬೇಕಾಗಿದೆ ಡ್ಯೂರಿಂಗ್ ಪೋಸ್ಟ್ಪಾರ್ಟಮ್. ಅವ್ರಿಗೆ ಏನು ಡಯಟ್ ಚೇಂಜಸ್ ಮಿಸ್ಟೇಕ್ಸ್ ಆಗ್ಬೋದು, ಅಥವಾ ಆ್ಯಕ್ಟಿವಿಟಿಗೆ ಹೇಗೆ ವಾಪಸ್ ಬರಬೇಕು, ಅಥವಾ ನಾನು ಪ್ರೆಗ್ನೆನ್ಸಿ ವೆಯ್ಟ್ ಹೇಗೆ ರೆಡ್ಯೂಸ್ ಮಾಡಬೇಕು, ಮೂಡ್ ಚೇಂಜಸ್ ತುಂಬ ಆಗುತ್ತೆ, ಹೌ ಟು ಹ್ಯಾಂಡಲ್ ದಿಸ್, ಇದೆಲ್ಲ ಕಾಮನ್ ಕ್ವೆಶನ್ಸ್ ನಾವು ಕೇಳ್ತಾ ಇರೋದ್ರಿಂದ ಟುಡೇ ವಿತ್ ಡಾಕ್ಟರ್ ಮಂಜುಲತಾ ಐ ಆಮ್ ಗೋಯಿಂಗ್ ಟು ಡಿಸ್ಕಸ್ ಆನ್ ದೀಸ್ ಟಾಪಿಕ್ಸ್ ಜಸ್ಟ್ ಟು ಬೆನಿಫಿಟ್ ಆರ್ ಪೇಷಂಟ್ಸ್.
Hi, Dr. Nisha. So it's a good topic that you have raised today, and I'm hoping it will benefit our viewers really well, especially the postpartum moms who are going through the phase of post-childbirth now.
Right.
So yeah, let's go on.
So we have Dr. Manjulatha here, the senior gynecologist from our hospital, and myself, Dr. Nisha, physiotherapist and fitness educator, and a new mom. So let me ask Dr. Manjulatha, ma'am, in the medically, what are the changes that the mothers are going through after postpartum? ಏನಕ್ಕೆ ಇಷ್ಟೊಂದು they are experiencing, maybe mentally ಇರ್ಬೋದು, emotionally, physically, physiologically. So ಏನಾಗ್ತಿದೆ ಮ್ಯಾಮ್ ಆ್ಯಕ್ಚುಲಿ?
See, postpartum ಅಂತಂದರೆ it starts from the day the woman delivers. The day the woman delivers till 6 weeks is very potential period when she has to take care of herself. Beyond that, up to 3 to 6 months, till the child is, completely dependent on the mother's milk. Say, which is 6 months, we start weaning from 6 months. Alva, you are a new mom, you will know that by now.
Yeah.
So that 6 months, she is draining out her entire energy.
Absolutely.
Through iron, calcium, everything which is going away from her body. She is going to be nutritionally deficient.
The best of nutrients apparently go to the baby.
Exactly. That's the best nutritious liquid or the best gift a woman can give the child is 6 months of exclusive breastfeeding.
Right.
So that is why that makes this postpartum period very, very important for every woman.
And very vulnerable.
Very vulnerable. Yeah. So generally what happens, there is a drastic decrease in estrogen and progesterone hormones. There's something called prolactin and oxytocin which increases. Adu ಏನು ಮಾಡುತ್ತೆ, encourage ಮಾಡುತ್ತೆ feeding.
Yeah.
So because of that, lot of changes happen in the women's body. ಮೂಡ್ ಸ್ವಿಂಗ್ಸ್ ಆಗ್ಬೋದು, ಪ್ರೆಗ್ನೆನ್ಸಿಗಿಂತ ಜಾಸ್ತಿ ಮೂಡ್ ಸ್ವಿಂಗ್ಸ್ ಪೋಸ್ಟ್ಪಾರ್ಟಮ್ ಅಲ್ಲಿ ಆಗ್ಬೋದು.
I know.
And especially when she doesn't have that support ಅಲ್ಲ, that is
rage ಬಂದ್ಬಿಡುತ್ತೆ.
Yeah. And I somehow assume I believe even husband needs a lot of support that time, not only the wife.
Absolutely.
Yeah. So that's when her nutrition has to be at peak. So this is why it is extremely important for the women to take care of her physical and emotional health during postpartum period.
Right. Yeah, that is so true. I can relate to that.
Yeah.
During pregnancy, everything is so lovey-dovey between the husband and wife, and when the baby is out, there's suddenly so much shift of focus.
Exactly.
And I think that's also a vulnerable stage for the relationships to be taken care of, as you rightly said.
I don't know if you have faced this. I have faced days wherein you get up in the morning and you feel so strengthless. For that first half an hour to 45 minutes before you get back to your work.
Yes.
It takes a while for you to, that setback is mainly because of your feeding during postpartum.
Correct. Especially the night feeds are so frequent that it just looks like we are just lying down, we're resting, but actually we're losing so many important nutrients and energy that shows up in the morning.
Correct.
Yeah. So doctor, ಈಗ ಡೆಲಿವರಿ ಆದಮೇಲೆ the family assumes that okay, the pregnancy is over and now the mother is probably back to normal. So according to you, ಯಾವಾಗ ತನಕ mother has to take extra care of herself? ಯಾವಾಗ actually postpartum recovery ಮುಗಿಯುತ್ತೆ?
See, that is what ಅದನ್ನ already, like how we discussed, postpartum period starts from delivery. ಆದರೆ ಡೆಲಿವರಿ ಆದ ತಕ್ಷಣ ಎಂಟೈರ್ ಫ್ಯಾಮಿಲಿದು ಫೋಕಸ್ಸು ಶಿಫ್ಟ್ ಟುವರ್ಡ್ಸ್ ದ ಚೈಲ್ಡ್. ಮಗು ನೋಡ್ಕೋಬೇಕು, ಮಗು ಹಾಲು ಕುಡಿಸು, ನೀನು ಇತ್ತಿನ ಬೇಡ, ದಟ್ ಗೋಸ್ ಆನ್. But they forget that the woman is still a supplier of milk and other energy sources for the baby. She'll be losing out more. So ನನ್ನ ಪ್ರಕಾರ ಮೆಡಿಕಲಿ ಡೆಲಿವರಿ ಆದಮೇಲೆ ಫಸ್ಟ್ 6 months ತುಂಬ ಕ್ರೂಷಿಯಲ್, ವೇರ್ ಶಿ ಹ್ಯಾಸ್ ಟು ಟೇಕ್ ಕೇರ್ ಆಫ್ ಹರ್ಸೆಲ್ಫ್, ನ್ಯೂಟ್ರಿಷನ್ ಎಲ್ಲ. ಇನ್ಫ್ಯಾಕ್ಟ್ 1 yearವರೆಗೂ ಆ ಎನರ್ಜಿ ಡ್ರೈನ್ ಔಟ್ ಆಗ್ತಾ ಇರುತ್ತೆ. 1 yearವರೆಗೂ ಇಸ್ ವೆರಿ ಪೊಟೆನ್ಷಿಯಲ್ ಫೇಸ್ ಫಾರ್ ದ ವಿಮೆನ್.
Yes, absolutely. I can relate to that. ಅಂದರೆ ಫಸ್ಟ್ 6 months ಅವರು ಜಾಸ್ತಿ ಸ್ಟ್ರೈನಿಯಸ್ ಆಕ್ಟಿವಿಟೀಸ್ ಮಾಡಬಾರ್ದು, ಆದಷ್ಟು ಬಾಡಿಗೆ ರೆಸ್ಟ್ ಕೊಡಬೇಕು. ಬಿಕಾಸ್ ಫಿಸಿಕಲಿ ಅಲ್ಲದೆ ಇದ್ರೂ by feeding she is losing lot of energy. By caring for the baby 24/7, right? So ಈ ರೀತಿಯಲ್ಲಿ ಟೇಕ್ ಕೇರ್. and nutrients ಯಾವುದು ಮಿಸ್ ಮಾಡ್ದಿರಾ, ಗುಡ್ ಡಯಟ್ ಫಾಲೋ ಮಾಡ್ಬೇಕು. that's all right. okay ಡಾಕ್ಟರ್, ನೀವು ಹೇಳಿದ್ರಿ ಲಾಟ್ ಆಫ್ ಹಾರ್ಮೋನಲ್ ಚೇಂಜಸ್ ಆಗುತ್ತೆ ಬಾಡಿಯಲ್ಲಿ, ಏನೋ ಮೆಂಟಲ್ ಸ್ಟೇಟಸ್, ಫಿಸಿಕಲ್ ಸ್ಟೇಟಸ್ ಅಲ್ಲಿ. that we spoke about. but ಈಗ some women deliver through section, some women deliver vaginally. so ಇದೆರಡು ಕೇಸಲ್ಲಿ what are the things to look for, red flags ಅಂತ ಏನಿರುತ್ತೆ? when do they know to worry and when should they just continue with their activity?
See, generally ಇವಾಗ vaginal delivery ಅಂದರೆ we know that if it is a primigravida, as in ಫಸ್ಟ್ ಸತಿ ಡೆಲಿವರಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅಂದರೆ we give a small cut called as episiotomy below. so wound care will be in the vaginal area more so. so ಅದರಲ್ಲಿ first thing, general nutrition, be it cesarean or C-section or a normal delivery, general things which she has to take care is up to 2 to 3 liters of water every day. People do not hydrate well, thinking that cold ಆಗಿಬಿಡುತ್ತೆ ಮಗುಗೆ, ನೀನು ಕುಡಿಯೋದಲ್ಲ ಅಲ್ಲೋಗುತ್ತೆ ಇಲ್ಲೋಗುತ್ತೆ. no, all that is not a myth ಅವೆಲ್ಲ.
especially summer deliveries.
correct. they are too dehydrated. ಇವಾಗ ಹಾಲು ಅವ್ರು ಕುಡಿಸ್ತಿದ್ದಾರೆ ಅಂದರೆ ಹಾಲ್ದು ಮೇನ್ ಕಾಂಪೋನೆಂಟೇ ವಾಟರ್. ಅವ್ರು ನೀರು ಕುಡ್ದಿಲ್ಲ ಅಂದರೆ ಏನಾಗುತ್ತೆ, the body will draw water from the blood. so when it draws water from the blood for maintaining hydration, blood ಒಂದು thicken ಆಗುತ್ತೆ. when blood thicken ಆದಾಗ blood clots ಆಗೋ chances ಜಾಸ್ತಿ. I don't know if you have heard about, we have seen a lot of patients when I was in government hospital, ನೀರು ಕುಡಿಯಲ್ಲ, they come in the midnight with loss of consciousness. CT scan ಮಾಡಿದ್ರೆ there will be a huge clot sitting in the brain, the blood vessel.
It's dangerous.
Extremely dangerous. She can lose her life because of this. So water ಅನ್ನೋದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್. 2 to 3 liters of water for a woman who has delivered right from the day of delivery is very important. Absolutely. That is one thing. And then people lose out on protein. Now protein, that is a building block of muscle alva. Protein with all the 9 essential amino acids. Even vegetarian ಅಲ್ಲಿ ಇವಾಗ ಸಾಕಾದಷ್ಟು ಸೋರ್ಸ್ ಆಫ್ ಪ್ರೋಟೀನ್ಸ್ ಇದೆ. ಬೀಟ್ ಸೋಯಾ ಚಂಕ್ಸ್, ಟೆಂಪೆ, ಟೋಫು ಆಗಲಿ ಅಥವಾ ಪನ್ನೀರ್, cheese also to some extent has so these are the things they have to add. In fact, I suggest my patients to even eat pizza, because ಅದು ಏನು ಬೇಸ್ ಇದೆ ಅದು ಮೈದಾ. ಬ್ರೆಡ್ಡು ರಸ್ಕು ತಿನ್ನಿ ಅಂತ ಎಷ್ಟೊತ್ತು ಅವ್ರು ತಿನ್ನೋಕ್ಕಾಗತ್ತೆ. ಬಟ್ ಪಿಜ್ಜಾ ಇಸ್ ಟೇಸ್ಟಿ, ಅವ್ರು ತಿನ್ಬೋದು. ಇಟ್ಸ್ ಅ ಗ್ಯಾಲೆಕ್ಟೋಗಾಗ್ ಅಂತ, ಲ್ಯಾಕ್ಟೇಷನ್ಗೆ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಬಟ್ ಅದನ್ನು ಕಾಂಪನ್ಸೇಟ್ ಆಗಿ ಹೈಡ್ರೇಷನ್ ಚೆನ್ನಾಗಿ ಮೇಂಟೈನ್ ಮಾಡಬೇಕು, ಕಾನ್ಸ್ಟಿಪೇಷನ್ ಆಗಬಾರ್ದು ಅಂದರೆ ದೇ ಹ್ಯಾವ್ ಟು ಡ್ರಿಂಕ್ ಅ ಲಾಟ್ ಆಫ್ ವಾಟರ್, ಫ್ರೂಟ್ಸ್, ವೆಜಿಟೇಬಲ್ಸ್. ಇನ್ ಫ್ಯಾಕ್ಟ್ ಎವ್ರಿಥಿಂಗ್ ಇಸ್ ಅಲೌಡ್ ಇನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ.
I think it's the balance that is so important, because commonly I've also seen bari bread rust ತಿಂತಾರೆ ಬಟ್ ವೆಜಿಟೇಬಲ್ಸ್ ತಿನ್ನೋದಿಲ್ಲ, ಕೋಲ್ಡ್ ಬರುತ್ತೆ ಅಲ್ಲ, then it can lead to constipation.
That's so there is absolutely no fiber in what rice and curry they have. ಏನು ಇರೋದಿಲ್ಲ, absolutely no fiber. So one is that nutrition. Then the 2 supplements which the women has to take is, one is calcium and the other is iron. Iron at least for 3 months, calcium at least for 6 months, as long as she's exclusively breastfeeding the baby. And along with that, vitamin D is also important. And in vegetarians they can include DHA, so that their bone health and muscle strength will improve a little. Other than this, there is no specific powders that you have to take, like protein powder or supplement. This much is the food. So coming to the red flags, what you asked about. Now when it is a C-section, the wound care I have mentioned in previous videos as well, that there is no special care required for the wound. Just wash, put with the regular soap and water, wash, keep the area completely dry. Because the sweat tends to accumulate there, which can cause infection. Again, hydrate yourself well, lot of vegetables and fruits. Red flags as in, if there is any hardness in the wound, or there is any pus or liquid or blood coming out of the wound, then immediately rush to the doctor. If there is severe pain which is not relieved even by the regular painkillers given, rush to the doctor immediately. Hospitals are generally 24/7 open. You can come, rather than taking your phone out to Google what is this, what is that. And excessive fever, please rush. Any chills the woman is experiencing, come. Hardness of the breast, because the milk can keep accumulating and it can cause even abscess. So hardness of breast, come immediately. Any difficulty in passing urine, please come immediately. So these are the C-section things that you have to come immediately for. And vaginal birth or C-section, vaginal bleeding is very important. Excessive bleeding of more than 2 to 3 pads in a day has to be reported immediately. Otherwise 6 weeks of on and off bleeding
There
they can
will
have.
be, yeah.
That is because uterus is coming back to its normal
Correct.
size. That can be there, so that's not an issue. So
Alright.
these are the red signs.
Okay.
Yeah.
That is such an important information that what happens honestly, since I've been there, the focus is so much on the baby.
You don't tend to take care of yourself.
So we might miss out on, okay, this is going on. ಇದಕ್ಕೆ ನಾನು ಹೇಳಬೇಕಾ ಯಾರಿಗಾದ್ರೂ ಇಲ್ಲ ಹೀಗೇನಾ ಎಲ್ಲರಿಗೂ ಹೇಗೇನಾ? This is the common question.
Yeah,
that
and
runs in
so
the
many of my patients don't take supplements. Despite telling them so much, I hope things will change slowly.
Yeah, I think as you said, ಎಷ್ಟು ವೀಕ್ನೆಸ್ ಫೀಲ್ ಆಗ್ತಾ ಇರುತ್ತೆ, ಎಸ್ಪೆಷಲಿ ವೇಕ್ ಅಪ್ ಇನ್ ದ ಮಾರ್ನಿಂಗ್. ಆ್ಯಂಡ್ ಥ್ರೂ ಮೈ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಐ ಹ್ಯಾವ್ ಸೀನ್ ದಟ್ ಇಟ್ ಇಸ್ ಗಾಟ್ ಬೆಟರ್ ವೆನ್ ಐ ಫೋಕಸ್ಡ್ ಆನ್ ಮೈ ನ್ಯೂಟ್ರಿಷನ್. ದೇರ್ ಆರ್ ಬ್ಯಾಡ್ ಡೇಸ್ ಡೆಫಿನೆಟ್ಲಿ, ಮಗು ಹುಷಾರಿಲ್ಲ ಅಥವಾ ನಿದ್ದೆ ಸರಿಗಾಗಿಲ್ಲ. ದೋಸ್ ಆರ್ ದ ಡೇಸ್ ವೆನ್ ವಿ ಕಾಂಟ್ ಫೋಕಸ್ ಆನ್ ಮೇ ಬಿ ವಾಟ್ ವಿ ಆರ್ ಈಟಿಂಗ್ ಆ್ಯಂಡ್ ಆಲ್. ಬಟ್ ದ ಡೇಸ್ ವೆನ್ I am doing that, I have seen drastically a lot of improvement in energy.
So since you are a new mom and a physiotherapist, so let me ask you some questions. See, according to me, what I generally suggest my patients is they can start walking. Immediately after 1 month of recovery, they can start walking, and after 3 months, regular exercises they can start doing. I do not suggest abdominal workout or ab training, strength training up to 6 months at least.
Right.
So what are your suggestions as a physiotherapist when it comes to exercises?
Correct. Nange experience ಆಗಿರೋದು ಕೂಡ as well as what we know is that pelvic floor is going to be very delicate. Or ನೀವು ಹೇಗೆ as you mentioned episiotomy ಕಟ್ ಇರುತ್ತೆ, ಆ ಪ್ರೊಸೀಜರ್ಸ್ ಆಗಿರೋದ್ರಿಂದ there is high possibility there can be tightness in the pelvic floor or in some cases extreme weakness. So ಹೀಗಿದ್ದಾಗ as you said up to 6 months strenuous activity like just dance ಹೋಗೋದು, Zumba, aerobics, heavy lifting of weights, so these are though definitely not advisable, can further make it more tight. So we recommend to start with walking and post that bed exercises just to increase the circulation and heal the pelvic floor muscles. Gentle Kegels movements, contracting the pelvic floor along with some breathing, synchronizing the breathing. And similarly, the abdomen muscles also have stretched so much for so long, so that they are quite loose and not toned. So we start with just breathing exercise to gently contract. Andre with an inhale we expand, andre with an exhale we contract the muscle gently for few days on the bed. And there are some very safe exercises to just lie down and do for the legs, because I personally also have experienced a lot of weakness in the legs postpartum. The pains here and there, ankle, knee and all, life ಅಲ್ಲಿ ಯಾವತ್ತೂ ಆಗಿಲ್ಲದೆ ಇರೋದು postpartum ಅಲ್ಲಿ ಕಾಣಿಸ್ಕೊಂಡಿರುತ್ತೆ, because we are always bending, handling the baby. So lie down ಮಾಡ್ಕೊಂಡು some glute activation exercise, some quad activation exercise safe ಆಗಿ ಮಾಡ್ಬೋದು without putting pressure on the abdomen, under guidance.
So basically to line up, you are saying pranayama and then pelvic floor exercises, as in Kegels exercises, where you contract the pelvic floor and release it. Probably you can hold for 30 seconds and release it, not immediately after episiotomy,
once
after
that is healed,
1.5 months ideally. And then hands and legs, things involving your glutes, hands and legs. Those exercises can be started.
Non-weight exercise, not like standing, squatting. Lie down ಮಾಡ್ಕೊಂಡೆ moving the hands and legs. There are so many such
exercises. So basically for flexibility and to develop on the core, you are saying breathing should do good now. Correct. Till maybe 6 months. You agree with that? 6 months is required for abdominal muscles to recover.
recover. ಹೌದು, ಯಾಕಂದ್ರೆ ಟು ಸ್ಟೆಬಿಲೈಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಇವಾಗ ಸಪೋಸ್ ನಾನು ಏನೋ ವೇಟ್ ಲಿಫ್ಟ್ ಮಾಡ್ತೀನಿ ಅಂದರೆ ಟು ಸ್ಟೆಬಿಲೈಸ್ ದ ಬಾಡಿ ಇನ್ನೂ ಕೆಪಾಸಿಟಿ ಇರೋದಿಲ್ಲ, ದೆನ್ ದ ರಾಂಗ್ ಮಸಲ್ಸ್ ವಿಲ್ ಆಕ್ಟಿವೇಟ್ ಮೋರ್ and tighten further,
and they will tend to harm themselves by putting down things and hurting themselves.
So I think we should not get carried away by that bounce back
so urgency. That's what. There is no hurry to lose weight. You can always lose weight. Focus on yourself for the first 6 months to 1 year, and then you can get back to your own self you will be beautiful and you are beautiful. So
Yes.
believe in that.
Yeah,
And
absolutely.
another main focus I wanted is about the emotional well-being, because here the women goes into, many of my patients need a lot of counseling to stay away from that postpartum depression. So that postpartum depression, is there anything specifically you teach in your postpartum classes about meditation, or what do you suggest for that emotional
Ma'am,
well-being?
honestly, what has helped me a lot is taking some me time. Right? So when the baby sleeps, see, the root cause for all this again, the physiological changes with rest, sleeplessness, it's like a lot of sleep deprivation over a period of. I think we should also learn to educate ourselves to keep the baby on a regular sleep routine.
Correct.
Alva? So if we make the baby
So
set
only
its,
if you're lucky that will happen.
So
my son had
Adarsh
not slept for 2 years.
yeah, I hear that a lot.
Yeah.
But yeah, lucky maybe. And maybe one the routine now on the timing marks or the timing. Others
So
too, we
you
should
tell
try.
us 5 hacks to sleep, have a tight sleep with the baby with you. 5 hacks.
5 hacks andre, I would say no evening naps. Early to bed,
nice.
cut down social activities, late night.
At least
for
2 hours
myself,
before
for
bedtime.
the baby's sake. 2 hours before bedtime. And then ಈ ಮಧ್ಯರಾತ್ರಿ ಎದ್ದಾಗ ಮಗು lights on ಮಾಡಿ ಮಾತಾಡೋದು
ಮಾಡಬೇಡಿ.
should avoid that stimulation, those things, and no talking to the baby and all in between.
Keep quiet
time.
so that baby gets used to being quiet.
Yeah, now it is night, I have to sleep ಅಂತ ಒಂದು
Right.
ಅರ್ಥ ಆಗಲಿ ಅಂತ.
Correct.
And day and night differentiation ಇರಬೇಕು. ಬೆಳಗ್ಗೆ ಎದ್ದ ತಕ್ಷಣ that showing sunlight and exposing to day environment, normally cooker whistle ಕೂಗ್ತಾ ಇದೆ, all that.
Okay. So all those signs will orient the baby towards
to the
day and
and
night.
night.
That's a very good point. So just to, is there anything else you feel we have missed that we have to emphasize on for our patients?
Yeah, I think one more thing ನನಗೆ ತುಂಬ ಜನ ಕನ್ಫ್ಯೂಸ್ ಆಗೋದು ಅಂದರೆ eating for breastfeeding. Right, as we were talking about. So we tend to think that, oh, I'm feeding the baby, so ನಾನು ಜಾಸ್ತಿ ತಿನ್ನಬೇಕು. So, but actually, jasti not in terms of quantity, right? That jasti has to be in terms of quality. Highly nutritious food tinadrinda.
Right.
I've observed that the baby is getting enough milk.
Correct.
And the baby's weight gain is on track.
Correct.
And then if we neglect our quality of food, and then we are wondering, oh, yaake baby hote tumta illa, yaake baby weight gain aagta illa.
See, what happens is,
Right.
now if an average woman requires 1100 calories for her daily needs depending on her weight and height, in breastfeeding she needs 500 more
Extra
calories
right.
to be eaten. But the myth is that 500 more calories comes with carbohydrate.
Correct.
Which is the wrong
very
thing.
poor on nutrition.
Exactly.
Right.
So increase everything. Increase your fiber, increase your protein, increase your carbs, increase your good fats, everything proportionately, so that there is no impact on your
so
weight.
maybe before baby ನಾವು ಈ ಡ್ರೈ ಫ್ರೂಟ್ಸ್ ಆಗಲಿ ಸಪ್ಲಿಮೆಂಟ್ಸು ಮತ್ತು ಸೊಪ್ಪು ತರಕಾರಿ we might be having on an occasional basis. Now it's just important to make it every day.
Every day.
ಅಷ್ಟೇ. Or maybe
there
the
might be
curd,
no
paneer.
time. There might be, you might be very busy. Baby might be very cranky, but this is the
See, the
basis.
whole point why we are getting off postpartum, holiday, sigate from work, all that is for this only, so that we take care. For what is taking care of ourselves? This is the bare minimum we have to do, I think. So that way we'll not gain that unnecessary weight, and just naturally the nature is constructed so well that with breastfeeding itself, sumar extra calories hottoga pregnancy weight sumar hottogatte baby ge. Right.
Yeah. So I hope this discussion is really beneficial for our audience, and take care of yourself. Your emotional and your physical health is extremely important for you as well as your entire family. So don't get stressed emotionally to back up and physically back up. We at Nectar are here for you. So you don't worry. Any help, you can reach out to us, and any doubts pertaining to this podcast, please put it on the comment section so that we can take it up one by one and answer it.
Yes.
So yeah, thanks Dr. Nisha.
Thank you, ma'am.
We looking forward for more such sessions with you.
Yes, surely. Thank you, everyone.
Thank you. Bye-bye.